So deprescribing is the process of withdrawing inappropriate medications supervised by a clinician, and the goal really is about minimising polypharmacy and multiple medication use and improving the overall goals of care. When we talk about medications being inappropriate, what we're really saying is that the potential harms outweigh the potential benefits in that individual. So it requires taking into account things like goals of care, what their values and preferences are. My background is actually as a pharmacist, and I used to work in a hospital, and it wasn't uncommon to see older patients coming in on 10 or more medications, 15 or more medications, even up to, I remember one patient that came in that was on 30 different medications, and it probably goes without saying, but there's a lot of harm associated with that. People change. A medication that was appropriate when it was first prescribed when someone was 50 or 60 may not still be appropriate when they're in their 70s or 80s. And there's a number of reasons for this. One of them is that as we age, our bodies change. And we know that for medications, older people have reduced metabolism and reduced elimination of these medications, which can lead to increased levels in the body. We also know that the sensitivities of receptors can change as well, which means that they might have an exaggerated effect to the medication or might actually have a reduced effect to the medication. Over time, somebody might end up with new medical conditions, new medications, and all of these things can alter the risk-benefit ratio for that individual. One of the main areas we've been looking into is how older adults and with and without dementia, as well as their carers, feel about polypharmacy, medication use, and deprescribing. And this information is really important because it can help inform interventions and education and development of information sheets for consumers. We've also been working on a number of tools and guidelines to help healthcare professionals to deprescribe in practice. So one of those things is we've recently developed a deprescribing guideline for cholinesterase inhibitors and memantine, which are the medications that are used to treat the symptoms of dementia. And essentially this guideline is meant to complement the treatment guidelines that we have that say when to start and how to start medications. We now have a guideline that says when to consider stopping, as well as how to go about stopping these medications. We have a couple of future research projects that we're really interested in, and these are really about optimizing medication use in practice. So it involves both development of tools to engage patients and their family members in the conversations about deprescribing, as well as providing tools to healthcare professionals, whether they be paper tools, information sheet, education, or online tools to help them in that decision making. The overall aim of this research really is to optimise medication use in practice, which will improve the quality of life of people, older adults, as well as people living with dementia.